First of all, I would like to thank the Deputación de Barcelona and the Forest Therapy Hub for this very nice invitation, and to say that it's a pleasure for myself and Margarida Rebelo to be here representing Naturelab. It's also a pleasure to see again the coordinators of Resonate and Green Me. And this has been a very interesting event, and we are very excited to be part of it. So let me start sharing the slides. So, I'm the pleasure of presenting to you Naturelab, the project approach to nature-based interventions for health and well-being. We are the coordinators. We are researchers at the Portuguese National Laboratory for Civil Engineering in Portugal. As it has been said, this project has been funded by the European Union. It's really very interesting to be able to bring you Naturelab, but this is a challenge. So our decision was that we would take you on a trip, also because the audience is very diverse. So we'll take you on a trip over the introduction, which is the context that raised the Naturelab project and which are the objectives of the project. And we'll speak about the partners and experimental sites. We'll mention the approach and activities, which are or will be the main outcomes from the project, and which are the top contributions to innovation and sustainability. So I don't know if you can listen to a plane, but Lanec is placed very near the Lisbon airport. So sometimes we can listen to the noise from planes taking off and landing. This is part of the urban environment. So we know that in urban areas, we have more than 50% of the world's population. And in some areas, we have very high population density. We also know, and we just acknowledged some noise, and we also have air pollution. It's common that there is some insecurity and sometimes, unfortunately, high crime rates. All these together with the hectic lifestyle in urban areas brings lots of health and well-being issues such as cardiovascular and circulatory problems, obesity, stress, depression, and others. We have heard about nature-based solutions, and in fact at LNEC we use it a lot. We use it to contribute to the urban stormwater management, to enhance the adaptation and resilience to climate change, and all these also supports biodiversity and ecosystem services. So we are used to deal with nature-based solutions, and we have each time more everyone which is responsible for the management of urban areas. They know that it's important to enhance the nature areas, and here I include not just green areas, but also the presence of water bodies. Now we even say that we need to have sponge cities. Sponge cities are cities that have within the territory and around it these green and nature areas. But more than that, even people that are working with nature-based solutions and trying to manage all these benefits, they are aware that nature-based solutions have also an added value for mental and physical health. They also contribute to safety in many dimensions, not just regarding natural disasters. They enhance the aesthetics of the urban landscape. They contribute to environmental education. They boost the feeling of belonging and place attachment from communities, and they facilitate social interaction. And of course, the late two also contribute to mental and physical health. So this is where Naturelab project raises from. We have been funded by the Horizon Europe program, and we are finishing the grant agreement preparation stage. We are very proud of having a consortium with 14 partners located in 6 countries, not just in Europe, but also in South America, Peru. We are very proud because even today in the morning, Naturelab was mentioned by one of our partners. And we have a presentation from another partner in Peru, Daniela from APTS have presented something very interesting, and we also have a project that will go on from 4.5 years. So our main objective is to bring innovation into the investigation and use of green and blue spaces as promoters of health and well-being. And we are also evaluating stressors such as air quality, noise, and also the role of solar radiation, because this is part of nature and we know that this is relevant for health and well-being. This is just to show you that we are working in this green oval shape. We want to build and enhance resilient, inclusive, healthy and green rural, coastal and urban communities. And for this, we want to enhance the use of nature-based solutions, and we want that nature within the urban territory is enhanced, is promoted and is used for health of everyone. And for this, we need to bring innovation to two pillars: a health pillar, where we need to bring stronger and new scientific-based evidences that can improve and the prescription of nature-based therapies. We also need to deal with legal, administrative, and financial issues, because if you want that nature-based therapies are taken up by the public and private healthcare sectors and other clients, we need to provide and to work with these mechanisms so that we can have these prescriptions used in real. At the same time, we are aware that it's not everyone who knows that nature can have this benefit. And so we want to contribute to raising awareness, to support people to connect with nature, and we want to boost the dialogue and collaboration among all these actors, including municipalities and other people that manage the nature spaces and the territory, so that we can in fact build a new social awareness and we can have the context where nature-based therapies can be widely used. So, coming to the partners and our experimental sites, because these are the people that will be working and the arena where we'll be doing our work. First of all, and as it has been mentioned in this summit, we have different types of nature, and we can contact or we can reach nature in different ways. So in Naturelab, we have and we'll use 3 types of nature. First of all, forests and protected areas. Then second type, which are urban parks, and we will also implement designed Naturelab therapeutic gardens. And last but not least, we'll use horticulture and gardening activities in several spaces. This is why. This is because these different types of nature are, of course, different and relevant, but we acknowledge that to be used by a population on a daily or weekly basis, maybe the 2 last types of nature are more friendly to this common use. So we'll assess what is the difference, what are the differences between using these different spaces. We have 15 experimental sites in all these countries, and we have already engaged 4 demonstrator fellows. The demonstrator fellows in Naturelab, they will take up our results in an advanced stage of the project, and they will make a final validation of our guidelines and protocols. So if any of you would be interested in the coming future, you are welcome to join as demonstrator fellows. Let me show you this map, and here you can see the location of the partners, the experimental sites, and demonstrator fellows. I don't have the time to go into detail with all the partners. First of all, I would like to call the attention to the fact that we have different latitudes, different countries. We have coastal and inside inland sites, and we'll have different climates, different cultures, different administrative contexts, and all this makes Naturelab extremely rich. Also, regarding the type of partners, we have research partners, research and education partners. We have organizations that deal with people and with health. We have SMEs, we have municipality, we have stakeholders, NGOs. So this is very, very, very rich. Forest Therapy Hub, I think I mentioned, is one of the partners. And as coordinators, we are extremely pleased and honored to be working with all these people, this team, which is highly motivated, and we understand, as mentioned in the previous presentation, that this requires that we work in a collaborative way, because all of us, we have not just different knowledge, but we hold different experiences. And so if we make this collaboration, this cross-cutting collaboration, then we can really work at these 15 experimental sites and bring all this novelty to research and science. These are the nature areas. Here you can see that the experimental sites are placed in coastal, urban and rural contexts, that we are dealing with different density situations, which also brings a different understanding of this variable. Here, this is the line with the nature and the nature will be tackling, and you can see that not all experimental sites are dealing with all of them, but we have a very huge representativeness of them. And also, this is almost cross-cutting. We will be working at all the 15 experimental sites with the healthcare and social care sectors, communities and citizens, researchers, policymakers, and key stakeholders. So I don't have another plan. I don't have time to go into details, but just have a show up of the variety of experimental sites. Let me present you this site, which is located in Portugal, around Lisbon. We have the National Park of Sintra Cascais. It's a protected area. It's an area for nature conservation, Nature 2000. It's very touristic, and we'll be working here with every type of people, children, adults, elderly, and with different health conditions, disabled, but also the general population. Now, another experimental case is in Rebelo. And here, this is already a nature area with classified biodiversity, but we will be designing and implementing a nature lab healing garden. Here we will be working with mainly with adults and elderly and tackling health conditions such as depression, anxiety, stress related to work and trauma. Let me just show you some pictures. On top you have Sintra Cascais National Park. You can see that it has also historic value, and it's located near the urban area and also near the coast. And at the bottom you have a Google view of Rebelo farm, where the healing garden will be implemented, and we have lots of space. We will be using part of the space to create this nature lab healing garden. Let's go on just for you to see how interesting the experimental sites are. The Garden of Barbosa is located in Amsterdam, and this is a very urban type of possibility. This garden is established on the top of a tunnel that covers a major highway. You see, so here we also have participants that include children, adults, and elderly, and we have migrants. And we have people with mental health issues. Still in the Netherlands, but in the Gelderland province, we will tackle a different approach. We will use surveys, statistics, and artificial intelligence to understand how people that live in a green area have benefits in terms of ecosystem services, benefits for health and well-being just by living there. Okay, so we can go on just to see in Cologne, Germany. We'll be working with our colleagues from the Cologne University Hospital, and here we will be also using patients with a diagnosis, a health condition, and we'll be using other types of assessment of health and well-being. Okay, let me go on. This is a place in Greece where we have people that live in these houses and they have health issues regarding mental disorders. You can see here the acronyms of our partners that will be dealing with the experimental sites. Now, what we'll be doing across all the 15 experimental sites is raising scientific evidence based on these cross-cutting experimental programs, and we will engage in total around 4,000 participants. We will develop methodologies and scientific evidence for the causal understanding of relationships between nature-based interventions and health and well-being benefits. We will identify mediators of the relationship between health and exposure to nature. And we also will deal with the nature. We will define a framework of indicators to classify forests, urban parks, and horticulture and gardening spaces according to their potential to contribute to health and well-being. And we aim at promoting the creation and management of nature areas within and around urban areas that can also promote ecosystem services and biodiversity. So our main outcomes are or will be customized nature-based therapy programs for populations with different needs. We will provide a portfolio of indicators to classify the potential of nature areas to promote health and well-being, and we will provide guidelines to analyze the health benefits of green areas. Also, this is connected with the creation and management of therapeutic gardens, horticulture and gardening spaces, because if we need to offer people quality nature spaces, otherwise it does not make sense that we are implementing nature-based therapy in spaces that, although being natural, don't have the required quality. We are also aiming at providing guidelines for funding schemes to support nature-based therapy prescription and promote integration of these in the public health sector. We know that it's very important to disseminate this knowledge, and we will train professionals all over the world. We will disseminate innovative education and training materials, and we aim at this overall contribution to sustainability in terms of economic, social, and environmental, bridging capacity building, exploring new types of jobs such as therapists, or even in the design of therapeutic gardens, or in the horticulture and gardening industries, designing, as I said, these natural spaces. And of course, we know that to do all of this, we need to overcome barriers and promote a common basis for action. We need that this understanding of where we stand is based on multidisciplinary collaboration, and we need to have this good collaboration and communication. For that, Naturelab will create a social innovation hub. We'll disseminate videos about the 15 experimental sites, sharing the visions and experiences from everyone who takes part of these experimental sites. And we also would like to invite you in advance for the 3 international meetings that will take place at different stages of the project, both in Europe and in Lima, Peru, and where we can also continue the discussion and this collaboration. Finally, I would like to acknowledge the International Collaborative Board of Naturelab, and that we are very proud in having here Elisete Leão from Brazil, Nevin Harper from Canada, and Maria João Figueiras from the United Arab Emirates. These top experts, and some of them that are part also of this global summit, will support us with their knowledge, their expertise, and also will ensure this constructive international cooperation, and also allowing an increased impact for Naturelab. So please, you are all invited to follow the project. In a few months, this will be on, as well as our social media platforms. And thank you for attending this presentation.